Hello, everybody. My name is Maria Papaioannoy, and I'm here with Rights for Vapers. With me, I have Craig Paul Prue, also known as KP, and Marion Burt, who is a consumer. And on Zoom, we have Dr. Douglas Elliott, a renowned human rights and constitutional lawyer in Canada. Today is World Vape Day, and I know for many of you, you just don't get it. Why is vaping so important? Vaping is a harm reduction tool, and we live in a country where we work hard to ensure that every single Canadian who has addiction has access to harm reduction, unless it's for those that smoke. Currently, a proposed regulation that started in 2021 has resurfaced. Earlier this year, we met with Health Canada, and they shared that the Minister of Mental Health and Addictions, Sachs, and the Minister of Health, Holland, would like to push through a dated regulation from 2021, where over 20,000 Canadians said no to a flavor ban. Since that happened, over 36,000 Canadians have sent individual letters to not only their MP, but both ministers, saying no to a flavor ban. A flavor ban on vaping products will have consequences, and we only have to look across the river here in Ottawa to see what happened with the flavor ban in Quebec. Black markets will increase. Access to vaping products will be easier, especially for the youth of our country. This is why they want to do a flavor ban, is to keep it out of the hands of minors. Yet, how will they be able to keep it out of the hands of minors in a black market, an unregulated market? I think that this flavor ban is performative. I feel that they need to take a moment and pause and look to see exactly how we can properly regulate this product in our country. I'm now going to allow Marion to say a few words.
My name is Marion Burt, and I represent the hundreds of thousands of Canadian adults who used to smoke but no longer smoke because they switched to vaping. I also represent the millions of Canadians who still smoke and will be denied a chance to switch to a product that is less risky than smoking. I started smoking when I was 19, and I continued to smoke for almost 40 years. I wanted to stop, but I tried all of the available products, and nothing worked. Nothing kept me off cigarettes for more than a year or two. And then 10 years ago, my doctor told me that I was developing COPD. So I looked into vaping, and I ordered a starter kit. Now, I didn't know anything about vaping at that time, so I also ordered a bottle of tobacco, flavoured e-liquid, and one of apple. I tried the apple, and it was at that moment when suddenly my taste buds sort of woke up to something better than burned tobacco, and I realized that I would never smoke again, and I haven't. I haven't stuck to the apple. I find as my taste buds are becoming healthier, that I like a variety. I like fruit, and I like dessert, and I think, why should anyone have the right to take away this pleasure from me? Yes, kids will vape, but they would vape if the only flavor available was spinach or tripe. They're not doing it for the flavors. They're doing it because they're kids, and kids like to experiment. They like to rebel. They like to do what makes their parents and authorities angry. So I ask you to, yes, stop the kids from buying the vaping products. There are laws in place, but don't turn your backs on the smokers in Canada and on the people who already experience better health through vaping. Thank you. I now turn it over to KP.
Hi, my name is KP Prue, and my vaping journey started after near-fatal overdose in 2018 at the height of the opioid epidemic, the start of it. I was found 18 hours later. I'll give you the quick story. 18 hours later, I was in a coma for 2.5 weeks. When I woke up, I didn't know how to talk, walk, or even swallow food. So I began my recovery journey then, and that's when I started vaping. I had been a couple of pack-a-day smoker, and my healthcare professionals were happier that I had quit using combustibles and started a safer way to my recovery journey. People are always going to find problems with whatever we do, but I think it's important that we as Canadians keep ourselves safe and we do the things that are going to make us healthier. So hopefully with what's coming up, we can stay strong and hopefully not have this flavor ban. I'd now introduce Dr. Douglas Elliott.
Good afternoon, everyone. My name is Douglas Elliott. I'm coming to you from Treaty 1 territory in Winnipeg, Manitoba. I'm not able to be there today because I'm attending an exhibit opening connected with LGBT history at the Canadian Museum for Human Rights. That's long been scheduled, so I wasn't able to be there today. I have been fighting for the rights of the LGBT community and others for many decades. I really got involved in the beginning because of the impact of AIDS on the LGBT community. And back when that fight began, we did have a lot of people who were promoting the idea of prohibition, close the bathhouses, gay men should just stop having sex. That was the solution that was proposed to the AIDS epidemic, but the LGBT community pushed back and said, that's not scientific, and that prohibition approach is not going to work. It's just going to, gay men are going to keep having sex, and what's going to happen is people are not going to get the information they need to protect their health. Every Canadian under the Charter of Rights has a right to make important choices about their health. That's why women in Canada have the right to an abortion. It's not because Parliament thought it was a good idea. It's because it's protected under Section 7 of the Canadian Charter of Rights and Freedoms. Smoking tobacco is one of the worst things that you can do for your health. I think even smokers like Marion would acknowledge that. And that's why most of the vapors that I have met, and I will say I'm not a smoker and I'm not a vapor, but most of the vapors I have met, the adult vapors that I have met, are convinced that this is the best way to get off smoking tobacco. And when they say it's safer, the scientific studies which I have read show that vaping is far, far safer than smoking tobacco. It is like night and day. It is like comparing getting punched in the nose versus getting shot by a bullet. That's the difference. It's an order of magnitude different. So in my view, the government of Canada and the anti-choice lobbyists who are leaning into this flavor ban need to keep their eye on the ball. And that is, how do we stop Canadians from smoking cigarettes? That is what we should be trying to do. That should be our objective. Of course, we know that vaping is the most popular and the most effective way for adults to reduce or end smoking. It's been demonstrated over and over again. Why would we take that choice away from adults because some kids are going to choose to vape? We don't ban the sale of cigarettes, even though some kids choose to smoke cigarettes. What we do is we try and restrict their access to cigarettes. And everyone I know that's a vapor has always stressed that they don't want kids getting addicted to nicotine. They don't want kids to be vaping, and they support tough regulations. But what they don't want to see is being denied access to this important product. And they also know that if they aren't allowed to vape because of their nicotine addiction, they're going to smoke. And we've seen that in Nova Scotia, they banned flavors. What happened? Cigarette sales went up significantly. So when we're making policy decisions, governments should be making their policy choices based on scientific evidence, not on fear, not on hype, but on scientific evidence. And there's absolutely no scientific evidence that banning flavors is going to lead to a reduction in smoking. In fact, all the evidence is exactly the opposite, that when you ban flavors, more people smoke, and that includes kids. So it is a nonsensical approach. Just because people are well-intentioned doesn't mean it's a good idea. Let's remember about 30 years ago, the anti-choice prohibitionists that are promoting a flavor ban now thought that the great way to stop smoking was to increase taxes through the roof on cigarettes. And the federal government went along with it. What happened? The cigarette trade was driven underground. We had organized crime, and we lost control of the cigarette trade. And eventually, the advocates of that boneheaded approach realized their mistake, and they reversed course. Well, let's not make that mistake again. I hear often people in the media and the anti-choice prohibitionists saying, well, these flavors, they're targeting kids, and that these things are aimed at targeting kids because they're sweet or they're fruit flavored. Well, I'm here to say, like Marion, I like the taste of apples. I like an apple pie, even though I know it's not very good for me, but I like a slice of apple pie. And as an adult, I should be able to make that choice, even if my husband doesn't like me eating dessert. That's my choice. And in this case, for Marion, it's even more important because she is doing it not just because it gives her pleasure, but because she wants to live longer. She wants to stay away from smoking tobacco, and we should be supporting her in that choice. We have lots of products on the market that have sweeteners and fruit flavors that arguably could appeal to kids. We've got some of those products in the studio today. The flavored vodkas, we've got here a creamsicle. What could be more calculated to appeal to underage drinkers than a creamsicle flavored vodka? And I don't know about you parents out there, but when I was a kid, we had underage drinkers. We knew it wasn't good for us. Oh, and there's polar berry. Now, don't you think that might be appealing to a kid? Look at those bright colors. These are the kinds of things that appeal to kids. And yet, not only do we permit it, but provincial governments and the federal government make a lot of money from selling these products. We don't ban them because we think some adults want to consume them. And we take the chance that maybe some kids might choose to use them because we trust our system to discourage. It'll never be 100% effective, but to discourage kids who are underage from drinking. I can tell you, I'm very familiar with the regulations right now around vaping. You will never see a product in a vaping store that looks like that. Today, they're not allowed to say that it's polar berry flavored or that it's creamsicle flavored. They're not allowed to use cartoons and other things. It is a very controlled presentation that legal products get. Of course, illegal products don't have to follow those rules. And there are illegal products on the market that clearly violate the regulations, and we want to get those off the market. The best way to get Canadians to stop smoking is to promote vaping. And the best way to keep kids away from vaping products is a well-regulated, lawful industry and not having these products forced on the black market. Let's not take away choice from adults. Kids are not dying from vaping. There's just no evidence that any kids have died from vaping. And yet kids die from eating peanuts, from being exposed to peanuts. Well, we don't ban peanuts or peanut butter for adults and from other people who want to use it just because some people might be harmed. We have to balance it, because under our charter, if you're going to take away charter rights under Section 7, you have to do it in a very carefully tailored way. And it has to be demonstrably justified in a free and democratic society. And I want to leave with one final note, taking us back to where we started. And that is under Section 15 of our charter. Governments cannot make laws that adversely impact on marginalized communities. And we know, don't we, KP, that gays and lesbians smoke a lot more than straight people. And we don't like the government telling us what to do. So when you take choice away and flavored products, you directly and negatively impact on important health choices that gays and lesbians make. We also have very high smoking rates in our Indigenous communities. This government claims to care about the health of Indigenous communities. Well, why are they now telling Indigenous people what to do, what they can choose? They should be supporting them in making healthy choices. And choosing flavored vaping products is by far the healthier choice when compared to smoking tobacco. The evidence is clear. Let's make smart, evidence-based policy decisions, and let's respect the rights of all Canadians. Thank you.
Are there any questions?
Yeah, certainly. Since you started the letter writing campaign, have you gotten any engagement from Minister Holland or Sachs?
We did not get any engagement from Minister Holland. We did show up at his doorstep on May 13th. However, his staff had the day off, which was a Monday. But with Minister Sachs, she did meet with myself and KP through Rights for Vapers, and Minister Sachs did meet with Marion. We have had people share with us that their MP got back to them, which prompted us to realize that there's still a lot of misinformation out there about vaping when it comes to our policymakers here in Ottawa and out in the constituency office. So we realize that education leads to empowerment, and empowerment leads to engagement. So we're still out there trying to explain that popcorn lung is not a thing.
As a follow-up, there are probably people watching who don't vape, have never vaped, and don't know the difference between flavored and unflavored vapes. Just in plain language, can you explain why it's so important, like what the difference is for the user?
I think as someone who does vape, and I have vaped since 2010, when you smoke, there is this burnt taste of tobacco, and it is a sense of familiarity when it comes to the addiction. And you don't know that it tastes better, but you are not smoking for flavor. You are smoking for the effects of the addiction, for the cessation of the nicotine. By switching personally, and from the many people that I've come across, is when you switch to a flavor, you still get that sensation without the nasty tastes. There is this derogatory statement that is shared over and over again. Oh, don't kiss a smoker. They're going to taste like a dirty ashtray. You don't have that when you vape. There's no smell associated to that is negative. and the flavors keep you away from that remembrance of that tobacco flavor. If you go to any addiction treatment center for alcohol addiction, they will tell you not to drink non-alcoholic beer. Don't drink things that taste like the drinks that you drank.
Can I add something?
Yeah.
I'd just like to add that yes, when someone who smokes switches to vaping, they're taking a chance, because cigarettes are a friend to a smoker, and they're going to discard that friend. And so anything that makes the change smoother and easier is a good thing. And the taste, the variety of taste is a major part of that. Because I know that, as I say, I started with apple. I did try the tobacco that I'd bought a couple of weeks later, but I found it so disgusting I threw it out. But since then, I have gone to vape stores and I've gone through and thought, oh, that looks good. Mango, coconut, and my imagination is caught up in it, and my enthusiasm, and that helped me, stay away from cigarettes and stay with smoking. Oh, sorry.
Is your cane? I think we also need to it's shall. I think we also have to remember that the regulation that is put forward, every single product on the market currently will be banned. They are creating a proposed list of ingredients that are allowed, 40 in tobacco and 40-something in mint. There is no sweetener. So even the flavor products that we currently have on the market will no longer be allowed because sweetener is added. We are going to have an unpalatable product. And the problem is that people who smoke and people who vape were not consulted, which goes against the National Drug Strategy. It is about meeting us where we're at unless you smoke. That is the message that we are getting from our Minister of Health. I know better. I will do better. And he has been quoted as saying he will decide on what we need to stay smoke-free. And that is so un-Canadian. I can't believe it.
Yeah, if nobody else is going to go. Do you have an estimate as to vape shops across Canada are going to be sitting on a lot of inventory that they can't sell if this flavor ban goes through. Do you have an estimated cost to the economy for that?
I've heard that it's in the billions.
The other thing is that the dedicated vape stores are the ones who help the people who smoke to switch. It can take an hour or a couple of hours when a smoker walks in. And the people in the store will guide them to the appropriate device and the appropriate nicotine level to start, and will show how the things work. Vape stores can only sell the vaping devices and the e-liquid. When only whatever the government wants in flavor is available, then, as we've said, the black market will wake up. All of the stores will close, or most of them. And so this service that the vape stores have provided for the last 15 years in helping smokers to switch to a safer alternative, that service will disappear. And that is a major loss to public health.
Thank you. This concludes the press conference. Merci.
Thank you, Dr. Elliott.
Thank you, Dr. Elliott.